In June, where a rash of lockdowns occurred, I labelled it the winter of Australia's discontent. Well, here we go again.
As of 6 p.m. tonight, we move into a 7-day stay-at-home order in South Australia with very few reasons why people can leave the home.
As promising as our progress has been, avoiding a New South Wales-style long, lengthy, very challenging lockdown where you just lose control of cases, we've avoided that, but we need more time. And that's why, on the advice of the Chief Health Officer, we will extend these lockdowns for a further 7 days.
We still had about 27 people who are infectious in the community out of those cases, and that's the number we really want to bring down.
So where does this end? Without enough vaccine, it simply doesn't. And what I spoke about yesterday with the situation where we have a divided nation at the end of the year looks on the cards, because at the end of the year, we could have a situation where New South Wales decide to live with virus cases with a higher rate of vaccination, and WA and other states maintain a no cases policy. Daniel Andrews was asked about this scenario where we live with the virus in the community and vaccination, and appeared to indicate it would depend on how Sydney goes. Also seemed to suggest a ring of steel around Sydney might be useful.
I just remind you all, we had a ring of steel around Melbourne last year, and it didn't just protect country Victoria, it protected the whole country. And I've had to announce these red zone permit changes today. I don't get any joy from doing that. Having to say to people that want to come home for the best of reasons, no, you can't. But we have got to, they're not locked into Sydney, so they must be locked out of Victoria. That's the choice I've had to make.
So are we going to hear from Scott Morrison today in regards to this crisis, with South Australia joining Victoria and Sydney in lockdown today? We haven't heard from him since Friday. Maybe the difficulty is, what is there to say before National Cabinet this coming Friday? Again, it looks like the premiers are running the country and the feds are somewhat impotent. Andrew's really laying the blame for this outbreak at the feet of New South Wales, the Victorian Premier.
We have a chance to be in lockdown to achieve 0 cases, not lockdown, and that's for days, as opposed to lockdown for months potentially to protect our health system. As promising as our progress has been, avoiding a New South Wales-style long, lengthy, very challenging lockdown where you just lose control of cases, we've avoided that, but we need more time.
Well, there must be plenty of Victorians raising their eyebrows over those comments, given the 112-day lockdown in Victoria last year. New South Wales Chief Health Officer Kerry Chant spoke yesterday about the prospect of children needing to take the vaccine for governments to be able to open up amid outbreaks. There is a proposal before the TGA for 12 to 16-year-olds to have approval to receive the Pfizer vaccine, and the federal government believes it has enough supply to vaccinate that age cohort before the end of the year. So that is on the cards. Now, we have seen this decline in daily COVID-19 case numbers to 78 in New South Wales today that Kieran mentioned, but the number New South Wales Premier Gladys Berejiklian has set as the important lockdown-ending marker is cases infectious in the community for more than 1 day, and that daily number remains about the same today, 27. This is a cause of concern. The hope has to be, when the restrictions announced Saturday start to have effect come Thursday, Friday, Saturday in the testing data, those numbers decrease. There are reports 800,000 vaccines are on the way to New South Wales from the feds and only 100,000 to Victoria. The Victorian Premier actually says that's fair enough. He says Victoria is running alongside the virus and trying to get ahead. He says they're far ahead of Sydney on this front.
I wouldn't begrudge Sydney access to additional vaccines, because Sydney, we're dealing with an outbreak that we think we are running alongside it. We just need to get in front of it in order to pull it up, and we need more time to do that. That is not even a conversation they're having in Sydney. They're in a very different set of circumstances.
The other concern in New South Wales are these reports that people are taking up to 5 days to receive their COVID test results back. Shades of Victoria last year before their stage 4 lockdown. This is clearly unacceptable. The blame on that has been pinned to one lab which has done 10,000 tests. If you don't get quick test results, you can't contact trace. you can't keep outbreaks under control. Danica DiGiorgio, our reporter, asked Dr Chant, the Chief Medical Officer in Sydney, about this delay.
It's taking up to 5 days for people to get their test results. And why is it taking so long? Are staff fatigued? Are there not enough staff? What is the current situation?
One of the private labs in particular did have some issues with scale, and you can imagine that it's been a double-edged sword. We're really pleased to see the community response to the testing, and that's part of the strategy. We're working closely with that company, and I note that they've put in a lot of additional measures to call upon other lab capacity in other states, but also up their administrative. And I think in the previous I've also indicated, please patience. I know it's a really difficult time, but we just have to make these sacrifices at this time. This is too critical. So if you are waiting for a test, I know 5 days is a long time, but I can confirm to you that the average time for that pathology company is around 28 hours. So there are outliers.